Hi, happy morning, everyone. Welcome to Meteor YouTube channel. I hope you are all preparing well for the exam. We'll start today's session. Some important 5 MCQ for AIMS and JIPMAR. We'll start with a small quote. Just believe in yourself, even if you don't. Pretend that you do, and at some point you will. That means if you are not believing yourself, at least act like that. In some extent, you will start do that. Okay? நீங்க உங்களை நம்பலைன்னா அதை நம்புற மாதிரியாவது ட்ரை பண்ணுங்க. ஒரு டைம்ல நீங்களே நம்ப ஆரம்பிச்சிருங்க உங்களை. ஸோ தட் பேசிக் செல்ஃப் கான்ஃபிடன்ஸ் இட்ஸ் வெரி மச் இம்பார்ட்டன்ட் ஃபார் எனி preparation, not only for exam and also for your life. Okay, we'll start today's session. First question: what is the fluid compartment that is found in certain body cavities like the spinal cavity, heart, lungs, and joints? Options are intracellular compartment, interstitial compartment, intravascular compartment, and transcellular compartment. So we have the various compartment in our body. So here the question is asking about the body compartment which is present in the cavities like spinal cord, heart, lungs, and joints. So the answer is, it is transcellular compartment. Okay. So remaining intracellular and the interstitial, intravascular, this also part of the fluid compartment only. This intracellular which is covering the examples like synovial joints, peritoneal cavity, pericardial cavity, intraocular fluid, CSF, all this combined to it's called a transcellular fluid. In next question, I will tell you where it is present detailing. Okay, so according to this question, the answer is transcellular compartment, which is certainly present in the cavities. Okay, yes. Next question. Select all the fluid spaces that make up the extracellular compartment. So this is select all questions. So more than one answer will be there. Okay, yes. So here the question is asking about extracellular compartment. So what are the things comes under extracellular compartment? The answer is ACD, that is transcellular, intravascular, and interstitial. Okay, these are the part of the extracellular. I'll show the picture. So this is intracellular, this green color part, and this is extracellular part. So in this extracellular, we have interstitial fluid and intravascular, that is blood plasma, and the very minimal, that is 2%, that is called transcellular fluid. As in first question, as I said, no, in cavities, in peritoneal cavity, all the cavities, we have the transcellular fluid. So this extracellular combining of 3 parts. What are they? Interstitial, intravascular, and transcellular fluid. These are the parts of the extracellular. Okay, you should know the percentage also. Intracellular will have the 55 to 70% intracellular will be there. Remaining 30 will be the extracellular. Clear? Yes. Next question. Which fluid below is considered an isotonic solution but work as an hypotonic solution? Very easy question. So the answer is answer A, dextrose 5% water. That is very, very important. If the same question is comes under dextrose 5% in normal saline, that is not a hypotonic solution. That comes under hypertonic solution. Okay. So what happened? Dextrose 5%, generally it is an isotonic. Before giving to the patient, it is isotonic. After giving, after entering into our body, the dextrose will be metabolized by our body. It become hypertonic in action. That is why dextrose 5% in water is initially isotonic, and after started giving, after entering our body, it become hypotonic. Clear? Yes. So the answer is A. Next question. Which patients below should not receive lactate ringus solution? Select all that apply. So here the question is asking contraindication of oral. Okay, lactate ringer or ringer lactate or Hartmann solution, where we should not give. The options they have given: a patient with a mild case of metabolic acidosis, a pre-op patient for abdominal surgery, a patient experiencing hyperkalemia, a patient with liver failure. So which conditions are contraindication for oral? The answer is option C and D. A patient experiencing hyperkalemia, already the patient is having hyperkalemia. The ringer lactate contains potassium. So again, the elevation of potassium level will be there. The further hyperkalemia can happen. That will be affect the patient. Next is patient with liver failure. The ringer lactate contain what? Lactate. The liver, whenever the patient is having the liver is a normal function is converting the lactate into bicarb. The liver failure, if you give the lactate, the liver cannot convert it into bicarb. So the lactate will be more. So that is why the patient with experiencing hyperkalemia and liver failure are contraindicated with the oral. In the option A and B, we can give. Here the question they given mild case only. Mild case of metabolic acidosis, we can give oral for the fluid replacement. And for the before the abdominal surgery also, we can give the oral to prevent the dehydration. Okay. Only C and D are contraindicated. Clear? Yes. So you can see this is ringer lactate. Sodium will be there, potassium, lactate, chloride, and calcium. It is an isotonic. Okay, it is not hypertonic, it is isotonic. Because the osmolality is equal to our blood. Next question. Your patient is receiving 0.45% of normal saline for hypernatremia. What finding requires you to stop fluid and notify the doctor? So the answers they are given: decreased sodium level, increased urination, confusion, and polydipsia. Very easy. The answer is confusion. So we will treat the hypernatremia with a hypotonic solution. 0.45 is an hypotonic solution. So whenever you are giving the hypotonic solution, the cell will get bulge because the fluid from the extravascular, it will go to the intracellular. So that cells will get bulge. So that causes confusion. What are the other symptoms? What are the other symptoms that can come? Mental status changes, confusion. Okay. In final stage, the patient can go coma also. Clear? So that is why the answer is option C, is confusion. Because of the bulging of the cells. Okay. Yes. Clear? Yes. Today we are ending this session. We will meet day after tomorrow. All the best for your exams. Take care.